Hey gang, it must be Wednesday, and so that means it is Wisdom Wednesday time here at Austin Dental Spa in beautiful Austin, Texas. We're going to have some fun today. Why the sunglasses? Well, if you've been tuning in this week, you know that our theme for the month of July is fun in the sun, and we're getting plenty of it. So we're going to talk today about something pandemic related. The studies are now starting to come out at the 2-year point. That's some really interesting stuff. What did the pandemic shutdown have to do with dentistry? Well, we're going to find out today, because the American Dental Association and another study that was done in a publication called Cranio, which is aimed at MDs, found out some interesting things about how the pandemic affected people, particularly people that grind their teeth, people that have migraine headaches. We've mentioned these things before back during the pandemic, that they were starting to see an increase as dental offices across the United States started reopening, because as you may remember, most all of us were shut down except for emergency palliative care only for at least 2 months. In Texas and in Florida, we were fortunate that after 2 months, the governors reopened the dental offices. In some states like New York, New Jersey, they were shut down for over 6 months. Pennsylvania, I believe, was one of those. So, but during the COVID pandemic, now these sociologists and scientists are starting to study this stuff, and they're publishing studies about with some really interesting stuff. The one in Cranio that I mentioned earlier had 506 participants in this study, and I thought you might find it interesting. Almost half of the subjects in this study had an increase in bruxism. What's bruxism? Grinding your teeth. Clenching would fit into that category too. 1/3 of the 500 and something people had an increase in temporomandibular joint disorders, or TMJ, TMD. Those are interchangeable terms. Pain in the jaw joint areas and forward of the ear. 36% reported an increase in the TMJ. 32% reported an increase in just general facial pain, and almost 50%, that's half, reported more frequent migraines or headaches. Now, just the pandemic itself and watching the news during all that stuff, if you can remember back 2 years ago, almost gave me a migraine headache, and I've never had one before. So, what do? Stop watching the news, because after a while it got to be like a broken record. So now let's talk about what the American Dental Association studied. This came out in 2021, coming up on a year ago. It was towards the end of the summer, last summer, and I remember when this came out. They surveyed 1,000 dental offices across the United States, and mainly they were looking for what percentage of your team have you brought back? How many people in your office have tested positive for COVID? Now, again, this is a year ago, right out a year ago. But they also asked them other questions like, have you seen an increase in certain disease states in your office? And this is where it gets interesting. Of the 1,000 dentists all the way across, randomly surveyed across the United States, coast to coast, 60%, 59.9% had an increase in chipped or cracked teeth. I certainly saw that. They didn't survey me, but my numbers would go right along with this study. So we got a pretty mainstream practice here. 60% increase in chipped or cracked teeth because people were clenching and grinding. A 52.5% increase in TMJ symptoms. So it kind of goes a little higher numbers than the medical study, but we're talking about dentists now. People with TMJ problems typically go to a dentist. 35%, 36% really saw an increase in dental decay. that one's a hard one to determine how much of that had to do with the pandemic, how much of it had to do with just a change in eating habits because there were no restaurants open. People were having to eat at home. People were ordering food to be delivered to their homes. So it could be that there was an increase in the amount of sugar being consumed, the amount of comfort foods being dealt with. I found in my own practice a pretty significant amount of bleeding gums, which they didn't include in this study, but we certainly saw our share of people. I've known their mouths for 20 years. They've had healthy mouths before the pandemic, and after the shutdown, when they finally felt brave enough to come to the dental offices, after 2 years of missing preventive care, they had bleeding gums. They had gingivitis all the way down to some bone loss, which is more periodontal disease. But these are people that I've known for 20 plus years and had healthy mouths before. And when I started quizzing them about what's changed in your routine other than you're working from home, almost 100% of them, as we walked through what their daily habit was before the pandemic. They got up, they took a shower, they brushed their teeth, they shaved, if they were a man, they did their hair, they got dressed, and they went to work. Almost 100% that were having problems after the pandemic told me, I said, what do you do? They said, I get up, I stay in my pajamas, I go grab a cup of coffee, and I sit down at my computer and start working. They skipped that whole morning routine, the brushing the teeth, the shaving, the doing their hair, the showering. So they were sitting at home working on their computers, and so they cut their oral hygiene habits in half by 50%. No wonder their gums were bleeding. So we saw that in our office. We certainly have made more than our share, probably double or triple the number of night guards that we've made since we've been reopened, coming up on a year and a half now, than what we did on an average month prior to the pandemic, because people are clenching, they're grinding, their stress levels are higher. And most of that is just from good old stress, from worrying about whether we're all going to make it out of this or not. We're starting to get answers, but again, these studies were done right on the cusp of reopening after the pandemic, and so the numbers might be a little skewed, but they also found some of it was diet related. People were consuming more sugar, which can affect the biome, the gut microbiome, which is the bacteria and funguses that help you digest your food. There are good ones and bad ones, and by changing their diet and eating things that they normally wouldn't eat when they were going to work, it changed their insides, and it made them more susceptible to problems in their mouth. So, who knew? It's been great reading all these studies and trying to find out what all is going on. So what can you do about it? Well, first of all, stick with the oral hygiene care that we've been talking about forever. Brushing, flossing, water picks are great if you're noticing some bleeding gums. Careful what you eat, because we become what we eat. And lastly, get out and get some exercise. Take care of your bodies, because the healthier you are, the healthier your mouth's going to be. So I always give a health tip, and my health tip for this week is get out there in the sun, but be careful when you do it. Try to do it early in the morning or late in the evening when it's not over 100 degrees. And we know that sun exposure, even 45 minutes to an hour of good bright sun exposure, which is no problem here in Texas, helps your body produce vitamin D. You can take it as a supplement, but it's more fun to just let your body do it for you. And that little bit of sun exposure first thing in the morning or late in the afternoon is a perfect time to do it when it's not so hot in the middle of the day. Probably 15 or 20 minutes out in the sun in the middle of the day would do it right now in Central Texas. So stay safe out there, use your sunscreen, and I'll see you next week for another version of Wisdom Wednesday.